on board here. And as soon as we do, hey, well, there we are. Welcome everyone to Back Talks with Dr. Sean McWilliams. This is your first time here. I want to welcome you. You're at the right place. If you are suffering with bulging discs and herniated discs and you're a mom and you don't know which direction to go and you're being told your only option is surgery, you're at the right place to get some great information to help you make decisions, okay? If this is your first time, please say hello in the chat. Would love to say hi to you, and if you have questions, I want to answer them for you today before you get off of this live so that you feel like you have some direction on which way to go, and so it can help you navigate the situations and help you get back to your life. And if this is your 100th time being with us, I want to welcome you back. It's great to have you here. So what are we going to talk about today? I'm going to teach you how to eliminate and go over how to eliminate your back pain naturally from the comfort of your home with an over 80% success rate. And I do that because we have worked with over tens of thousands of patients. So I have a little bit of experience in this, and I want to share some of my knowledge with you so that you know what's possible, okay? Hey, Marisa, great to have you here. Welcome. So let's get into it. So some of the common questions that people, have at night, especially my moms, is why does my back keep hurting? Am I going to have surgery at some point, which is a scary thought to have? Am I ever going to feel good again? Will I always have pain in my back or my neck? What if my pain keeps getting worse? What am I going to do? Will I be paralyzed someday? Am I ever just going to feel like my old self again? I had these same questions that I was asking myself, just so you know, when I injured my back, which I'll show you here in a second. So I want you to know that I have walked in similar shoes. So if you're suffering with back pain or chronic neck pain, especially due to bulging in a herniated disc or spinal stenosis or facet arthropathy, you're at the right place because I've walked the walk as well. So some of the other things that people wind up being afraid, and I'll tell you, I had some of these thoughts too, is, will I always have back pain for the rest of my life? Is this something that I'm going to have to live with? I've tried everything and nothing has worked. I've heard that multiple times. In fact, I was on a call with a gentleman today, and those are exact words that he said. I've tried everything and nothing has worked, which is really sad. I will tell you that the majority of people have never tried spinal decompression when it's done properly, and so we're going to talk about that today. That you're afraid that you might not ever be able to provide for your family again, and you're never going to be able to be active again like you were, prior to your back pain. That you'll never be the spouse that you want to be again, and that perhaps do you ever think that, I won't be able to get to play with my children or my grandchildren like I dreamed of doing, or God, will I wind up in a wheelchair someday? So all real questions to ask. So, if you don't know me, I've been very fortunate in my practice over 25 years. We were on the cover of a lot of magazines for our expertise. I hope that tells you a little bit of something. Also in 2019, 20, and 21, I was voted one of the top spinal decompression doctors in the entire United States. We're proud of that. I worked really hard to do that. And the reason that we are is because we helped a lot of people get back to a great life again. And that's how we got that way. And we did it without surgery. Also had the opportunity to work with some amazing people over my career as well. Perhaps you might recognize some of these faces. So, and now my dream is to share this with you. And I always show people, this was me after a week after falling at the skateboard park. And yes, that was my low back. So I have had severe injuries to my back. So you're not alone, okay? I've experienced it. I know what it feels like to be in chronic pain like that, and I know what I did to get it back, and I'm going to help you do that too, okay? So let's talk about this for a second. What causes back pain? Well, it's a great question. Most people don't always know. A lot of people always wonder where their back pain is coming from. So let's clear up some information for you. The number one cause of spinal pain is the spinal disc. The second cause of spinal pain is typically the facet joint. So what I want to talk today about is I want to talk about the spinal disc. If you've been with me before, we've talked about facets. You can go back and look at facet pain on one of our lives. We have a lot of information on facet pain. Today I just want to talk to you about the disc. So what is the disc? Well, the disc is a fibrocartilaginous piece of cartilage that goes in between each one of the bones in the spine except for one area. And this is an example of a low back one. The neck ones look exactly the same. And there's two parts. Number one part, right here, called the nucleus pulposus. And what that is that's this jelly-filled center that I'm going around. And it literally is like jelly that you would put on toast, except it's clear. The second part of the disc that you need to know about is what's called the annulus fibrosus, or they'll call it the annulus. And that is these outer rings that you're seeing around here. They're concentric rings, which means that they wrap all the way around and they lap each other like this to make it very strong. And the entire purpose of that fibrocartilage basically is to keep that jelly inside the disc. And actually, when we move, that jelly acts as a liquid ball bearing. And its job is to move with inside that disc, and it is the job of the annular fibers to hold it in there very strong. It's like having about 12 belts on your pants so your pants don't fall off, except this job is to keep that jelly on the inside. Unfortunately, if you have an injury or a micro trauma, sports, poor posture, things like that, the disc can start to become dehydrated. When it does, it has a greater propensity to tear, and then this jelly can start to migrate out like you're seeing right here. And that's when we wind up into a herniated disc. And we don't want that because those usually press on nerves. And the disc itself can become painful, and the pressure on the nerve can also be painful. If you watched the other week, we talked about how annular fibers have what's called nociceptors around the outer 1/3. So this outer 1/3 part right here can be very sensitive to pain because it has pain receptors that sit all the way around it. The inner part of the disc doesn't. So that's why that can be a source of pain for you. So you got to know where to look. That's why the disc causes so much pain for people. So let's take a look at an MRI here. Just going to show you a couple things. So this is a pretty standard MRI. For the most part, we're going to call this a relatively normal one. So I'll go through a couple things. There's 5 bones that make up the low back. This is lumbar 1 that sits up here, lumbar 2, lumbar 3, lumbar 4, and lumbar 5. We have discs that sit in between, like we were just talking about. That's that space right here. And when everything's healthy, we don't want to see where this disc is pushing into this area at all. The other thing you're going to be looking here is you're going to see this big white area like this. That is called the thecal sac. And the white area is actually spinal fluid, cerebral spinal fluid. The gray area, as we come down through right here, is your spinal cord. Okay, without getting too crazy technical about it. If you're wondering what this blue area right here is, that's the spinous process. Those are the little bumps that you see that come off of our low back. So when you bend or twist or you bend over, trying to get a good angle for you here, these pieces are what you see going down the middle of someone's back, okay? So that gives you some basic normals. Let's look at a couple other things. What you'll also see if you have a good clear MRI is you'll see these gray lines. These gray lines are called traversing nerve branches. And what they are is they are the nerve branch that is actually coming off of the spinal cord. So when the spinal cord exits, this is your spinal cord, you have nerve branches that come off to each side. Okay? And that's what they are. So those are the nerve branches that are traveling down. If you look at this model right here, you can see them. So if you see all those little fibers right there inside, those are your traversing nerve branches. Okay? And every time you get one that comes off, you'll have less and less as you go down through the cord. And on this next slide, we're going to see a herniation. Without getting too technical about terms, we'll just call it a herniation right here. You can see this black blob of nuclear jelly that has come out. And one of the things that you can see right here is you can see one of the traversing nerve roots, and then you see the other traversing nerve root going down, and you see that this gray blob is starting to put pressure onto that nerve. You can see you get a herniation below as well. So again, those are your two most common areas, lumbar 5 and lumbar 4, that get degenerated first in the human body. And when it gets pushed onto one of those nerves like that, very commonly, you're going to get sciatic-based pain going down into your buttock and leg. All right? So we don't want that. So I hope that helps you understand where pain can come from. Let's talk about some solutions. Let's add some sunshine to all of this icky stuff. So, can you fix this? Yes, you can. What are the success chances? 80+% success rate. Can you do it without surgery? Yes, you can. How successful is surgery? 38% on average for most people, and the definition of that is that they felt better than they did before. How many people usually need surgery after it in 3 to 5 years? Over 50% of people will get another surgery in 3 to 5 years. So if you don't want to go down that road, and most people don't need to go down that road unless they've had a major trauma or they have a cauda equina syndrome, which is an emergency situation in the spinal cord, lumbar traction, intermittent traction, done properly to create spinal decompression of the disc has a very, very high success rate, and this is what it looks like. So when you can do it at home, when you came to my office, we could use computerized tables. These tables are designed to you at home, and this is what we based Disc University around, which is the course that we've created to help you be able to do this from the comfort of your home, so you don't have to go find doctors in your community that might have this equipment. You get a virtual me in your home, and I teach you how to do it, and you just follow our guidelines with it. So what's the purpose of doing this? Well, the purpose is you're taking diseased discs, like you can see right here, where the red ones are. They're getting compressed because there's not enough space. It's pushing onto the nerves and causing pain, and you are doing the opposite of that. You're creating an intermittent traction to elongate the spine to help create more space for the nerve to get out, get oxygen and nutrition back into the disc, and get the body to start to heal. Can it happen? Yes, it can. And this is the process that it goes through. So let's take a look at this quickly. So you have a herniated disc. It's pushing on the nerve branch right here, more than likely causing pain. What we first want to accomplish is we want to help pull that disc material back into a more normal position. Granted, everybody heals differently. Hey, Sue Sheckler, how are you? Great to have you here. Happy Easter to you too. And what we want to do is we want to pull that disc material back in, and then we want to start to fix this outer part of the disc that you see down here, and eventually get this disc to heal. And that's what we accomplish. And you got an over an 80% success rate to do that, and which is really amazing when you think about it. So let me show you a pre and post MRI of one of our patients that went through this process. So as you can see right here, this person had severe low back pain, sciatic pain, muscle weakness, constipation, couldn't travel or be an active dad in his business, had a massive herniation that was indenting this entire, remember we talked about this is the thecal sac, this area all the way through here, interrupting his cerebral spinal fluid, putting a lot of pressure on his low back. Again, you can see on this axial view, if you know what you're looking at, big, massive jelly blob coming out, putting pressure on his nerves. This is him 12 weeks later. No back pain at all. Rehydration of his discs, no sciatic pain, normal bowel function, and back to running a business and being that dad that he wanted to be. So is this stuff possible? 1,000%. It is. And if you're being told that your only option is surgery, I want you to get onto my call list and schedule an appointment with me so that we can chat. You know, I'm not against surgery. I have some great friends who are very good surgeons, and I would totally trust them, but I want you to know surgery should be option probably 5, 6, or 7 for you if you're not in an emergency situation. And instead of being pushed by an orthopedic surgeon to go and get surgery because they want to learn a new technique and practice it, and you get to be the guinea pig, and they get to make a lot of money off you, instead of recommending you go do this for 12 weeks first, and then if this doesn't get you better, then let's go have that conversation again about getting surgery done. That's how it should be. And if you don't believe me, look at Tiger Woods, because Tiger Woods should have been recommended to go this route, didn't. What surgery is he on? Number 5, and the guy still has chronic back pain because he went a surgical route. And once you get one surgery, it's like eating a potato chip. You can't just have one. You got to have two or more. Same thing happens. All right? And I don't want that happening to you. And that is why I created Disc University. Disc University is a course we worked on for over a year and a half to help you learn to do this and actually be able to do this from the comfort of your home. And we teach you everything that the discs require to get healthy, from hydration to disc nutrition to stretching to core exercises. The main hub of it, of course, is spinal traction, intermittent traction, and we teach you how to do it properly to help get the disc to rehydrate. So if you're suffering with back pain or you know somebody that is, please go and book a call with me. We'll sit down for 15 or 20 minutes and we'll chat about what's happening with you, and I'll give you some recommendations. If I think Disc University might be a great fit for you, I'll let you know that. And if I don't think so, I'll also let you know that as well and also help guide you. You can go to booking.drshawnmcwilliams.com. You can get on my calendar. You'll fill out a form. You'll get to see some cool pre and post testimonials on there, some pictures, some amazing stats. But at the bottom, you can get on my calendar. You'll have to fill a form out and let me know about your back pain, what you've done, who you've been to. So I'll have a great idea so we can have a real conversation about what's happening and which direction to go with you, okay? There's a limited spot for these. My schedule's pretty busy, but you'll be able to go on there and see what's available. Book something so we can start to bring some hope and sunshine and light back into your life, okay? So go to booking.drshawnmcwilliams.com. Hey, I hope that this has added some value to your life. If you know someone that's suffering with back pain or neck pain chronically and they're just being told they need surgery and they said that they've tried everything, they haven't done this, they haven't tried everything. Let me tell you that, because I've heard that a lot of times and saved a lot of people's lives and got them back to being the people that they want to be and not living on drugs and surgery for the rest of their life. So, and I want that next person that you love to be in that same boat of success. So hope you'll share this. If you like our channel, hope you'll subscribe to our channel. You know, we do this every single week at the same time. We talk about different subjects, all related around chronic back pain and helping you manage it and feel more empowered by being more knowledgeable. So hope this has added some value to your life. Please subscribe, hit the notification bell, and I hope you'll share this with people if it brought value to your life or you think it'll bring some value to someone else's life. I need your help. I can't meet everybody in the world, but between all of us, we can make a major difference in how this world manages back pain. And let's let surgery be a later option and not the first option for everybody, okay? So, Sue, great to have you here. Marisa, great to have you here, and everybody else. Thanks so much. I hope you guys have an amazing rest of your day, and I will see you next week if you don't have any questions for me. So if anybody's got a question, fire away. Would love to answer it for you. If not, we will say goodbye. So any questions, anyone? Going once. All right, well, hey, if you can't think of something, but you do have one, you can hop on a call with me. We'll have a Zoom call. If not, you can always DM me on Instagram, or you can leave me a comment here, and I'll get back to you. All right, you guys, happy Easter, everyone. See you soon. Ciao.